So I'm going to try to explain NAD, nicotinamide adenine dinucleotide, and how it is probably the most effective treatment, IV treatment for those who have become intoxicated by various things, including pharmaceutical drugs, psychopharmaceuticals, environmental toxins, endotoxins produced by bacteria in the body. It is really, I think, the most important approach besides other adjunctive supportive therapies. But in order to understand how NAD works, it's really essential to understand how a cell functions. NAD is let's call it a natural component of cells at the mitochondrial level, and really drives the energy or ATP production, which is like the engine that also accelerates the activity of all the components, the nucleus, etc., inside of the cell. So let's begin by understanding how a cell functions and how NAD is a vital component of that optimal functioning of cells. So here is a cell and all the components. It's much, much more sophisticated than this, but it's a simple drawing to get an idea of what is inside the cell. You'll notice the nucleus. Every cell has a nucleus except for, I believe it is, red blood cells don't have a nucleus. But what we're going to focus on is the mitochondria. And there are, we're made up of over 30 trillion cells, and most of the cells in our body have a very high rate or metabolic rate of activity, especially heart cells and brain cells, with hundreds and sometimes thousands of these mitochondria, which again are like the engines in the cell. They do much more than just simply produce energy. They produce free radicals, important part of the mitochondrial function, as well as various antioxidants. So this is a fairly crude, illustration of a mitochondria with a double membrane, the one at the sort of yellowish orange, and then the inner mitochondrial membrane, which is so sophisticated. There are books, thick books, hundreds of pages just on the membranes of the body. So we're going to focus on the cristae, which is the inside of the mitochondria. So the if you think about how small a mitochondria is, let's just go back for a second. The lower right-hand side, this is 1 to 2 microns. So if we look at the tip of a standard sewing needle, you could fit about 750 mitochondria on the tip of that needle. And so we have, 40, 50 trillion cells. We have much, much more mitochondria in our system, which really drives our metabolic rate and the vitality and how we're feeling as far as our health is concerned. So back to the cristae and the mitochondria. Here is, don't worry, I'll get into this in a very, very simple way. This illustration is totally remarkable as far as I'm concerned about what science knows about the deepest interior of our body, inside the mitochondria, and the production of this energy. This is what's referred to as the Krebs cycle. But what I want you to notice here is there's an NAD. Again, this is a reduced form. This is the form that is used for intravenous treatment. And you can see where NAD plays a vital role all around this whole cycle of energy production. And how the originator was able to find a compounding pharmacy or formulator for making NAD is really, his story is remarkable what happened. So this is where the ATP is produced in the inner membrane of the mitochondria. Back to the cell again. So what disrupts the function of a cell and leads to, and I'll talk about this more, as mitochondrial dysfunction, which I feel and research is proving is that so many chronic illnesses, both physical and mental, are due to the decline in the production of energy by the mitochondria. It's referred to as mitochondrial dysfunction. So when pharmaceuticals enter into or through the outer membrane of the cell, they enter the cell and trigger a certain response. But they also leave behind their residues inside of the cell, which causes the mitochondria to begin to cause a decline in its activity. But it's not just pharmaceuticals. It's also these petrochemical herbicides and pesticides. These also get into the interior. They also affect the outer membrane and cause havoc with various receptor sites. Many of these chemicals are what are referred to as endocrine disrupting chemicals, which are disrupting the function of the cell and mimicking various hormones. Again, petrochemicals, plastics, endotoxins, which are partly in some ways produced by the cells of our own bodies, and if our avenues of purification are not working properly, then they start to accumulate and get inside, remain inside cells, or the cell cannot, is so weak it cannot excrete its own waste products. Endotoxins are also those which are produced by various pathogens. Many people have silent, low-grade chronic infections, bacteria, spirochetes, viruses, and mold. These are all what are referred to as exotoxins or biotoxins produced by these pathogens. They're just categorized. I've categorized those as well here as endotoxins. Again, I mentioned mold before. So again, there's another little illustration, again leading to mitochondrial dysfunction. So lowered energy production by the mitochondria leads to a decrease in the function of that cell. You know, tissues, glands are made of specific cells which have a function, so you can have a cell that's producing, let's say, cortisol, or a cell that's producing thyroid hormones. They each have their own particular function. And when the ATP production goes low, these cells, all the cells of the body, brain cells producing serotonin and whatever neurotransmitter it might be, they all begin to decline in their function, which leads to chronic physical and mental symptoms. And those can, these are just, general symptoms, but they can also cause various chronic illnesses related to neurological issues, etc. So just another illustration that a lot of the individuals that come to us for the IV NAD are those that have been prescribed multiple types of pharmaceuticals and antibiotics, that they realize their health has been declining since beginning them. These people also have a lot of other residues in their cells, and not just the pharmaceuticals, but it's like the pharmaceutical is the last straw that really tipped the scales towards having symptoms. And now that the mitochondria are not producing as much energy, they have a very difficult time getting off the medication and can feel unwell for many years after. So this is part of the reason why there is addictions to these chemicals, is because people can't stop them. They've got so many symptoms, and when they try to get off the medication, their symptoms just get worse. And their symptoms really, the side effects or symptoms due to these chemicals, these synthetic pharmaceuticals, is because primarily of mitochondrial dysfunction. And they have severe symptoms of withdrawal. So back to the Krebs cycle for a moment. What we want to do is to increase the production of energy. I'm not sure what the next slide is, but just one second. Yeah, so increase ATP by providing the mitochondria with NAD, and that will increase the cell's activity. And that will help people to improve their overall symptoms in general. I'm not sure why. Oh, yes, okay. So here we have the previous slide of all these pharmaceuticals and herbicides, etc., coming into the cell and leave their residues, and the mitochondrial function declines. So when the mitochondria begin to produce more ATP and the cell starts functioning better, one function of the cell is to excrete toxins. So the result is that pharmaceutical residues start coming out of cells, as well as all the other residues and chemicals that were residing in the cell. They're also excreted. And this is the tremendous result of the NAD, increased cells activity. And I think that's it for now. Oh, no, we're not. Okay. So these are the three primary compartments of fluid in the body. On the left, we have the cell. The whole cell contains its own fluids. And when we get these toxins starting to be expelled or excreted from the cell, they go out into the interstitial fluid, which is primarily lymph. I think that's the next slide. Yeah, lymph. And it can also go from the lymph into the bloodstream, but most of these residues come out into the lymph. And this, this is part. The NAD is really essential. I don't know of any other way that can be as effective for detoxification of all these residues from the interior of the cell. But they are then excreted from the cell and go into the lymph fluid. And one issue that is not addressed with most of the IV NAD therapy you'll find online is there needs to be additional supportive therapies to help drain these residues that are coming out of cells. Otherwise, they'll circulate around. So we've got the blood liquid, we've got the liquid or fluid inside cells, and we've got the lymph fluid. Lymph basically bathes all the cells of the body. And if that lymph is not draining properly, these residues will simply be absorbed back into cells again. And if that lymph fluid is not running like a stream or a river, the cell cannot detoxify. There's sort of a balance or homeostasis between what's inside the cell and what's inside the lymph. If the lymph is already toxic, the cell has a really difficult time transporting through the membrane these waste products into the lymphatic fluid. And we'll get into that much more later on. Oh, here we are, detoxification. So these are the important adjunctive therapies that help to optimize the benefits of NAD therapy. So on our left we have the saunas, really important IV therapy, vitamin C and alpha-lipoic acid and various things, colon hydrotherapy, and also lymphatic drainage on the right-hand side. We use an old naturopathic treatment for hot and cold packs and also sine wave to drain lymphatic system. But we'll get into that later on. And that'll be part 2 of all the purification therapies that are greatly beneficial or optimize the benefits of the IV NAD. And we'll get to that soon. Thanks very much.